This Week in Virology, the podcast about viruses, the kind that make you sick. From Microbe TV, this is TWiV, This Week in Virology, episode 687, recorded on November 27th, 2020. I'm Vincent Racaniello, and you're listening to the podcast all about viruses. Joining me today from Fort Lee, New Jersey, Dixon Despomier.
Hello, Vincent. Good to see you. It's a little bit cloudy out there. It's a little coolish compared to yesterday, but yesterday was like summer, so that was kind of weird. There's no rain in the forecast, and I think actually it's pretty comfortable right now.
Also joining us from Madison, New Jersey, Brianne Barker.
Hi, it's great to be here. It is cloudy and 59 Fahrenheit, 15 Celsius here, and, very turkey-filled.
From Austin, Texas, Rich Condit.
Hi, everybody. 69 degrees, cloudy, kind of drizzly type thing. Going to be rainy tomorrow. It's fine with me. Sort of 'tis the season.
And from Western Massachusetts, Alan Dove.
Good to be here. And it's 53 Fahrenheit, 12 Celsius, overcast, gray day, and 100% chance of turkey for dinner.
Our guest today is Dean of the National School of Tropical Medicine, Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine, and also Director of the Texas Children's Center for Vaccine Development. Peter Hotez, welcome back to TWiV.
Thank you. It's thunderstorms rolling in here. We have 2 seasons here on the Gulf Coast. In Houston, we have summer, and then there's something called August, which you don't want to know about.
Are you originally from Texas, Peter? I don't remember.
I'm from Hartford, Connecticut.
Okay.
Right down the road from me.
Yeah, absolutely. Where are you in Western Massachusetts?
I'm right outside Springfield.
Oh, yeah. Yeah, well.
And you haven't acquired a Texas accent, huh?
No. I'm sort of a hybrid. I have a few Stetsons, but I still wear the bow tie. So
wait a minute. Stetsons are made in Philadelphia, Peter. I don't know if you knew that.
I see. This is why I'm here.
It's true.
I come here to get educated.
That is my only contribution to this conversation.
It's too bad we don't have Bob Guads on this call as well. Then we'd really learn something.
Although my Stetson was made in China.
I just want to remind listeners that Peter's been on 2 of our podcasts before. TWiP episode 29, Neglected Tropical Diseases with Peter Hotez, and you can listen to his history there. And then he did a TWiV special not too long ago. That was December 2018. Vaccines did not cause Rachel's autism. It was around the publication of your book about your daughter.
Pre-apocalypse.
Pre-apocalypse.
Indeed. And now we're in the apocalypse. And so let's talk about the apocalypse, Peter. So, I wanted to remind everyone, Peter is at Baylor College of Medicine, where a very important vaccinologist used to be, Joe Melnick. Did you ever meet him, Peter? You must have, right?
No, I met his widow, but Joe Melnick founded the Department of Molecular Virology at Baylor College of Medicine, which I think was the first virology department in America. Dedicated to that, and that was with the founding of Baylor College of Medicine. It started in the late 40s. I don't know exactly when he started the department, but there's a lot of virology history here.
I was once chairing a session where Joe and Albert Sabin were on. And, Sabin used to talk a lot. And at one point, Joe leaned over to me and said, Vincent, if you don't control him, he's going to take over this meeting. And I said, you're asking me to control Albert Sabin? Not happening.
And I never met Dr. Sabin either. I'd gotten to know his widow, Heloisa Sabin, who passed away just a couple of years ago, and used to visit her apartment because towards the end of Sabin's life, they lived in Washington, D.C. off Nebraska, New Mexico Avenue. So I used to visit their apartment, and I described this in my new book that's coming out called Preventing the Next Pandemic, Vaccine Diplomacy in a Time of Anti-Science. And, there are pictures of Sabin with, Castro and Fidel Castro and Bill Clinton and the Pope, and it was really extraordinary to spend time with her.
His grandson went to our School of Public Health, so I got to meet him. He was a nice kid, very nice kid.
So that's the title of your next book, Preventing the Next Pandemic, Vaccine Diplomacy in an Era of Anti-Science.
In a time of anti-science, yeah.
Sounds great. Sounds
and
great.
was that?
Like
and actually, I started writing it before COVID. You know,
I was wondering.
Well, it basically says, we were making great progress in vaccinating the world's children up. And then around 2015, there was a bit of an unraveling due to forces that virologists don't ordinarily think about, such as war and political collapse and socioeconomic collapse and urbanization and climate change and how all those forces combine in interesting ways in places like Venezuela and the Arabian Peninsula and Africa, and even on the Gulf Coast of Texas. And so it tries to make the case that what happened with COVID-19 is more of a culminating event on top of an unraveling that was already occurring, rather than, just something that occurred in a vacuum. Things have been going downhill for the last few years, and a lot of it being fueled by this anti-science empire, which comes from different directions: far right-wing extremism in the U.S. under this banner of health freedom, medical freedom, and then the national groups like Children's Health Defense and RFK Jr., and then the Russians, and even now QAnon and neo-Nazi groups. So it takes a dark turn very quickly. And how you say that with sounding credible. I mean, this is the hardest part, talking about the anti-science movements, is, you start going on and on about the Russians and neo-Nazi groups and QAnon and the Kennedys, and pretty soon you sound like,
you sound like guys, you should be
that's throws things at the TV at night, right?
Yes.
That's right. So
the other network, not CNN.
So based on your mentioning of that, made me think of something I hadn't really thought of before. I know that we worry about some of those anti-vaccine groups in the United States influencing uptake of the COVID vaccines. Do we think that there are going to be similar problems elsewhere because of what you were just mentioning?
Oh, yeah. I mean, well, first of all, what happened was, and I have a couple of papers out in Microbes and Infection about this, where you look at what's happened with the health freedom, medical freedom movement that came out of Texas and Oklahoma. Now what they've done in 2020 is they've glommed on protests against masks and social distancing and contact tracing, all under health freedom, medical freedom. And it's a reason why, COVID-19 right now is overwhelmingly in the middle part of the country, and especially in the red states. And there's a reason for that. It's from this is death by anti-science. And eventually it'll occupy the whole country. But if you look at the worst affected areas of the country right now, it's Texas and the upper Midwest. And, this terrible story that came out of Slate and elsewhere, people's, last dying words.
Exactly.
Or that COVID-19 is a hoax. This is not due to COVID-19.
Yeah.
So not even letting people die with dignity. It's just this is, and one of the frustrations I have with, going up against the anti-science groups is you don't get a lot of support from the federal government agencies. A little bit from NVAC now. NVAC has sort of come around and been really good. But, for years, the CDC has always said, no, we can't talk about this. You'll just give it oxygen. And I said, really? I mean, that was 20 years ago, but this horse has left the barn. This train has left the station.
I'll say.
This is out there. And then the private foundations don't want to touch it either. So and then when they do, it's all about, hey, we got to fine tune the message. We got to amplify our message. And I said, look, you can, fine tune that message all you want, but it'll get you about 30 to 40% of the way there, because your message is a message in a bottle and floating in the Atlantic Ocean. There's now more than 480 fake anti-science websites, all revved up on Facebook. If you go to Amazon.com and put, books up at the top, as everyone has done, and you press return, you'll get a scroll down menu at the left, health, fitness, and dieting. You click on that. You go to vaccinations, and it's all fake anti-vaccine, anti-COVID hoax books. I mean, that's
That's incredible.
Amazon's the largest promoter of anti-science right now, and then all glommed down by Russia. So, I've been writing now. I have a paper under review, which I'm struggling a bit with, that says, just fine-tuning the message is not enough. We've got to do the unpleasant task of dismantling the anti-science confederacy or empire. Well, and the minute I say that, I find myself all alone talking to myself. Nobody wants to join. Nobody wants to join me on that fight.
They all stepped back a few faces.
Yeah, that's right. It's like SpongeBob. Hey, well, good luck with that. Good luck with that.
They hand you the bell to put on the cat.
A central issue with this is presumably you want people to take a rational approach to the science rather than embracing these bizarre conspiracy theories, but it's a fundamentally anti-rational movement. I mean, if you look at the core of it, the health freedom, medical freedom banner, many, if not most of the people under it are vehemently opposed to any kind of medical freedom when it comes to things like women's health care. So they're not reasoning even on the face of it. And how do you approach that? How do you dismantle that?
Well, I'd say there's a majority of people who are not deeply dug in. They're just so inundated with the disinformation and misinformation, and they're different. Right. But then there's this really hardcore element that's causing a lot of damage, and how you begin dismantling that. I think, and I have an article that I just put up. It came out in Microbes and Infection about the Biden administration, what they should be looking at in the early days. And that includes looking at how we finally confront the anti-science empire or confederacy. And it's going to require, at the U.S. government level, an interagency task force. I mean, you can't rely on the HHS agencies alone to take this on, because it's gone beyond that. We need to bring in departments of commerce and State Department. Because of the Russian involvement, we have to bring in Homeland Security. It's a tall order. I mean, the problem is it's not like people want to rush into taking this on. It's not like we don't have other problems, number one. And, they see how terribly I get beat up. Robert F. Kennedy has now publicly labeled me the OG villain, which I had to look up. It stands for original gangster villain.
Yes.
So you should just call me that on your podcast. Just say, today we are interviewing the OG villain.
That's right. Peter, what do you think their ultimate objective is then? I mean, what do they got in mind? What if they succeed? Okay, then what happens?
I think they're different agendas, right? I mean, in the case of Russia, they want to destabilize democracies and destabilize the U.S. In the case of smaller players, I think they figured out how to use this to monetize the internet, and other people are selling fake autism cures, and
so it's not all the same agenda.
No, that's right.
They didn't manipulate the election.
They just all meet around a common hatred of Peter Hotez.
We love you, Peter.
So, Peter, I had the same basic question of Dixon, and that is what fundamentally motivates this. And this, I figured, as Dixon did, that the health freedom thing is really just kind of a ruse, and that it's money at its core. So I'm wondering if there's
in the case of health freedom, they're getting we think a fair bit of money from traditional donors of these far right-wing groups. Right. And I mean, this goes back to also, you have the Koch family supporting the Great Barrington Initiative and that kind of stuff. So a lot of it are coming out of far right-wing donor groups, I think.
So is there is a possible approach to this? I know this is problematic, but is it a possible approach to this somehow cutting into the profit, making it so that it's somehow illegal to profit from disinformation?
Yeah, no, I think all these things are on the table, but again, nobody really has the appetite to take this on. The other thing is it's now globalized, right? You had CBS News, other news sources reporting that Robert F. Kennedy was the lead speaker at the Berlin, Germany rally they reported linked to QAnon and neo-Nazi groups. And so it's just this very dark place. And it's almost like fighting terrorist cells in some ways in terms of the complexity and picking up the chatter and it would take real work. I mean, the UN agencies now talk about fighting the infodemic, and I think that's a component of it. They listed vaccine hesitancy as in 2019 as one of the top 10 biggest threats to global health, and so this is globalizing also.
Yet these individuals who take this position, if they get sick, they go to the hospital, right?
You would think.
And they want the latest treatment. You got it right.
I mean, the biggest denier of COVID and face masks and everything, the president went right to the hospital when he got sick, right?
Right. And he got the cutting edge treatment too.
The monoclonal antibody from Regeneron, right?
Derived from fetal cells, by the way, we must add.
But so this gets to what's going on in the U.S. right now, which is, if you look at the top 12 affected states, and they're the highest rates of COVID-19 in the world, by the way. So with the epicenter of COVID-19 is in the U.S., but it's overwhelmingly in the middle part of the country. And if you look at the 10 of the top 12 states, they're all red states. Yeah. Right. It's all so with the exception of Minnesota and New Mexico, it's all red states. So, and West Texas is really bad. The Panhandle is really bad. So how do you reach those groups now? Because the White House is checked out, right? They're not involved anymore. And I don't know if they're really going to listen to the Biden administration or not. We'll have to see. I mean, the task force has got some great people on it, but 100% blue state representation, all 13 from blue state, and pretty much all the Acela corridor and San Francisco. So who does this? Who takes on, talking to the red states? So I've decided I'm not going to wait. I'm just doing it. So I've been actually reaching out to conservative news outlets. Fox News has let me back on now, which is great.
Really?
So I did that.
Really, Peter?
Did that this morning. and the Daily Caller. I did the Daily Caller. And,
the Inquirer.
And
the cover of the Inquirer.
The DC Examiner. I feel you have to do it if you've got to save lives. And
but do they actually print what you say, though, or do they listen to what you're telling them?
Well, I'm doing it live, so in some cases. So
do they challenge you in any way?
No, I think they understand. I mean, I sort of give a mom and apple pie message that it's hard to counter, and it goes something like this, which is that good vaccines are coming, right? We'll have at least 4 vaccines in the U.S. COVID-19 we have a vaccine also that we're developing, but that's right now in India. It's a recombinant protein vaccine, but they're all targeting the spike protein. I think the spike protein turns out to be a pretty soft target for this virus. Or as Carl Zimmer says, clumsy prey. You target the spike protein, get a good vaccine.
Injured game.
Yeah, exactly. So we'll have good vaccines, but the key is keeping everybody alive between now and then. I mean,
that's right.
I mean, the numbers coming out of the Institute for Health Metrics now are absolutely chilling. They're saying 500,000 Americans will lose their lives from COVID by the time we reach a week or two after the inauguration. So
right, but the problem, Peter, is that
nobody has to die. That's what's so.
Well, and
sometimes
the latest CDC data are that we are still grossly underestimating the number of cases. By possibly a factor.
Oh, that I'm sure. I mean, so the point is, how do you convince people in the red states to keep your father, your mother alive, and your brother and sister alive just for a couple of more months until vaccines are here?
Sure.
And reminding and trying to explain to them that the Scott Atlas, all that bullshit from Scott Atlas, that it's a hoax and COVID deaths were not caused by COVID-19 and fake herd immunity concepts. So I'm just doing it. I'll see where it goes. Being here in Texas, and maybe I have some credibility from that alone.
Did you see the interview with the Navajo tribe leaders as to why the death rate is so high in the Navajo Nation? And he said a lot of people, they know they shouldn't gather in groups, but it's tradition to do that when somebody dies. So they're celebrating the death of someone, and in doing so, they're engineering their own deaths.
Yeah, well, look at DR Congo and Ebola, right? It was all
I was just going to say, it's
very similar.
Well,
and it's right. I mean, or look at the Haredi in New York, right?
Yeah.
I mean, or the Hasidim. They just had a 15,000 person wedding. Not a mass.
Exactly.
I just just last week, the reason I was not on TWiV last Friday, I was attending a funeral. And we had extensive discussions. It was for my father-in-law. But we had extensive discussions within the family, like, how do we do this? And he happens to have been somebody who dedicated his life to fighting infectious disease. He was an infectious disease pediatrician. Yeah. And so
who was it?
David Hotez.
Oh, sure. I knew David.
David Hotez.
Yeah. He was at Mount Sinai.
Yeah.
He died? I didn't know that. I knew him very well.
That's right. You knew him. Hamish knew him.
Well, I knew him. Well, because I had interviewed for a position as to replace him as head of pediatric ID at Mount Sinai.
Oh,
so I got to know him a little bit, and we always thought we were sort of separated at birth because the name Hotez and Hotez, probably it's because I'm Jewish. It's the same source.
It's the same origin.
Galicia, which is in Ukraine or Poland or Austria, depending on which war you were in. And when you landed and the immigration official took your name down, you got it as Hodes. I got it as Hotez.
That's amazing. That's amazing.
Yeah, I'm sorry to hear that.
Me too.
It was
natural causes.
It was not COVID. It was not COVID-19, by the way, and it was not a surprise. It was something that we saw this coming. But a big part of the discussion was, we want to honor his life, but we also want to honor what he stood for and not get ourselves infected with this pandemic virus.
Exactly.
So we did it. We had a small outdoor graveside gathering with. It ended up being exactly 10 people, which is the maximum. And then we went back to his house and just stood around outside. Basically, there were some bagels in the dining room. People went in and one at a time and got some bagels, and that was the wake. And this was not the way that we would normally have a funeral.
Exactly.
But the idea was, he would have wanted us to be careful, and everybody was masked up except when we were standing around outside eating. So it was done very carefully, but I can fully understand people who are maybe not as up on the etiology of disease, being less careful under those circumstances and saying, well, under these circumstances, we're going to make an exception.
Right.
We're going to.
His father was, if I have this right, was one of the giants of American pediatrics.
Yes, Horace Hotez.
Horace Hotez, along with Jacoby and Janeway, and these were the sort of the founders of American pediatrics.
Horace and one of his colleagues they actually discovered rotavirus, but they didn't quite get to the point of identifying it. Like they found a filterable agent that was causing diarrhea in kids, but they weren't quite and didn't end up being the discoverers. But I didn't mean to make this about me. We were discussing funerals.
It's all. And what about the meatpacking industry? I mean, they're undergoing a tremendous upheaval, but only in some states. Virginia has lots of meatpacking, and you don't see this happening in Virginia. You see this in North Dakota, South Dakota. I think you've got, these. I always block on the name of this book. It's The Jungle, but I block on the author.
Upton Sinclair.
That's the one. That's the Sinclair Lewis. I always put those two of them.
Well, no, Sinclair Lewis wrote about Rockefeller University.
Right. So he did. That's right. So you've got a work ethic.
Institute.
The work ethic.
But the story about Upton Sinclair in that book, The Jungle? It was the urban legend is that when Teddy Roosevelt read it, he threw up in his cornfleks, and that's what led to reform in the
it's back. They didn't reform for very long, unfortunately, I'm afraid. And these are all migrant workers, as far as I'm led to believe.
Right. Brienne, you had a question there, please.
Yeah, my question was about you're talking about how you were going to approach people in red states, and I've spend a lot of time, because of where I grew up, thinking about how do we approach people who live in more rural areas, as opposed to kind of those of us who are in sort of the urban near New York City sort of areas. Do you have any thoughts about how, we can change that messaging for people in different parts of the country?
Yeah, well, I mean, if you look, there is a bit of an urban-rural divide, right? I mean, if you look at Texas, for instance, if you look at a blue-red map of Texas, you've got these big blue blobs in the shape of a triangle because that's the Texas Triangle. It's Dallas, Houston, San Antonio, Austin, which are predominantly liberal, and then it's in a sea of red, which are all the non-urban areas. So it's not entirely, but it's more of an urban-rural split. So very much so, yeah. I mean, and you see that when you drive around Texas. I mean, in Houston, it went for Obama and it went for Biden, but you drive, 10 miles outside of Houston, it's all Trump signs everywhere. Sure. So it's
yeah.
So how do you
blue states too? So how do you?
Yeah, take up Brianne's question. How do you communicate with the rural population?
Yeah. As I say, right now, I'm just really focusing on what I have access to, which are the conservative news outlets, and hope it picks up steam. But we got to move fast because people are dying pretty quickly. I mean, we're going to be at 3,000 deaths per day pretty soon.
I don't mean to trivialize that, Peter, but you and I know a lot about tropical medicine. We've co-authored a book together. You talk about malaria all the time. You talk about the death rate for malaria. It's like 1% or 0.9% of the entire number of cases. And so people tend to, big deal, and COVID is even less. It's like 0.1% death rate, but it's in a certain group of people, right? So people tend to trivialize that. If they think they're not susceptible to the big effects, they're going to misbehave and say, well, I'll just get sick a little bit and then they'll be
Well, this is what's made it so hard, right? Is this Janus face of COVID-19. Exactly. You have one cohort that's getting sick and going into the ICU with horrible vascular injury and thrombotic events. And then you have a much larger piece that are either asymptomatic or low grade that are spreading the virus around. I mean, when we had the first SARS-1, if you had SARS-1, you weren't walking around going to box stores, right? You were sick and going into the hospital, right? But with COVID-19, it's not that way. And that's what makes it so challenging is that high rate of asymptomatic infection, maybe up to 50%. It just it's made it impossible.
So do you think that the reason why China is doing so well is because they revere the elderly? And they don't want to threaten their lives, so they will obey the rules because?
Well, I think one was, people use the word lockdown in the U.S. We don't know what lockdown is.
That's true.
Lockdown means in the U.S. means you can't go to your favorite bar at night, unless they can sell nachos, in which case they're called a restaurant, and then they're no longer a bar. But in China, they were, nailing people's doors shut. So that was pretty, that was one reason. I think the other, and I'd be curious about Vincent's opinion about this, is the data coming out about the D614 to G mutation in the spike protein, not the receptor binding domain part, but the other part of the spike protein that's helping transmissibility. So what was coming out of Wuhan did not have that mutation, so maybe not as highly contagious. And now we've got something that's a little more problematic. But that's still, I think, somewhat speculative.
Yeah, we definitely have ideas about that, but I think the way we have reacted is far more important than that particular amino acid change.
In our case in the U.S., it was, the Scott Atlas disinformation. It's a hoax. COVID-19 deaths are due to the comorbidities, not due to the COVID-19, and this Great Barrington and the herd immunity, 22%, and discrediting masks and spectacularizing the response around hydroxychloroquine. All that disinformation really. It's been. We'll be studying this for years to come.
Well, but it probably
death by disinformation.
Go ahead, Brian.
I was just going to say, I also think that there is a little bit of a messaging issue. I think there are a lot of people out there who have this idea that it's either you die or have the sniffles. And they don't have an idea of some of the other parts of the morbidity that people are seeing.
Yeah, no, I agree.
I think that needs to be talked about more.
And even though we're lowering mortality rates in ICUs because we're putting people in prone positions and giving them dexamethasone and anticoagulants, who wants to go through that? And and who wants to deal with the long-term and the neurologic consequences from stroke and cognitive disturbances and unipolar depression resulting? I mean, we need someone like the Institute for Health Metrics to not just look at deaths, but also what the other metric they use, which is DALY's, disability adjusted life years. And that's going to be massive because the deaths are just one piece of this.
Yeah. And nobody seems to talk about that as much.
Right. I agree totally.
Yeah, but in addition, all this misinformation and disinformation and such was happening in a complete vacuum of federal leadership.
Right.
Which I think is that seems like a really fundamental issue, right? I mean, if you had all this disinformation going on, but there was a unified message coming from CDC saying, here's what every state needs to do, and some level of enforcement of that, they might
absolutely. So when I started going on CNN and MSNBC, the first piece I would talk about was that I'm really worried about the healthcare workers. But then the second piece was, hey, there's no, you'd listen to the White House Coronavirus Task Force. And, after you got through the vice president and is saying he and his wife, Karen, are going to pray for us, then you realize there was no information out there. And then it suddenly dawned on me, there is no federal response. It's the states are being asked to do this. And the U.S. government, we'd heard from AZAR, will provide backup FEMA support and supply chain management and manufacturing PPE, but let the states figure it out. And the problem is the states never had, the epidemiologic models. They didn't know how to do it. And they also needed the political cover of the federal government because everything was so politicized. How do you deal with all the, like in Texas, how do you deal with all the Freedom Caucus and the health freedom people? So there was no political cover for them. And that had catastrophic consequences. That's when you started seeing that big summer surge take off in the southern half part of the United States. And then he went full on anti-science. He brought in Scott Atlas, and that's when all the disinformation came. And those are what, so the key now is to bring it back to a federally led response. I think they'll do that. I think, the concept of a coronavirus task force is so discredited by this time that we definitely do not want this federal response led out of Washington, D.C. It needs to be brought back to Atlanta. It needs to be run out of the CDC.
Here.
I think the most important hire the Biden administration can make right now is the CDC director who's going to lead that response.
Absolutely.
And then the other question that I still don't have quite figured out, the way the press is talking about the CDC is, except for this very good article in ProPublica, is that it's mostly because of White House encroachment and interference. I think there is more than that. I think there were some internal failings at the CDC that caused them to not pick up the virus entering from Europe into New York and all the testing. So the other piece to having the CDC lead that federal response is really understanding what went wrong and fixing that structurally. So having a really strong leader who's capable of running CDC is going to be vital for our success, because we're not going to just vaccinate our way out of this. It's even though I say, vaccines are around the corner, we got to save lives next few months, it's going to be a while before we get a significant percentage of the U.S. population vaccinated. And we don't know whether these vaccines actually stop virus shedding from their nose and mouth. So, for instance, if you look at the non-human primate study of the AstraZeneca vaccine, it reduced the amount of virus in the bronchoalveolar lavage and in the lungs and the histopathology, but those monkeys were still shedding a lot of virus in their nose and mouth. So even after, and I don't know if that's going to be true of the other vaccines or not. So I'm guessing even if we get a high percentage of the U.S. population vaccinated by, say, next summer, there could still be a lot of virus circulating. So we're going to still need a lot of leadership to figure that out as well.
So how do you think that sort of the changes in federal response might impact vaccine deployment? And when do you think, you mentioned next summer being a time when people might get vaccinated? When do you realistically?
Well, no, I think people will start getting vaccinated in a couple of weeks, but it'll take time to get up to speed, and it'll depend on how many vaccines we have. I think we'll have the 2 mRNA vaccines. I think AstraZeneca vaccine went through some bumps this last week, but eventually it'll get put in front of the FDA, and that will get released. Then we'll have the J&J vaccine. So we'll have, I think, 4 vaccines by the early part of next year. And then, our vaccine's being scaled up in India now. We don't currently have a good pathway to get it into the U.S., but at least as a low-cost global health vaccine.
What's the platform for your vaccine?
Just simple as can be, a recombinant. It's the receptor binding domain, recombinant protein expressed in yeast, just like the way the hepatitis B vaccine is made. And, you can make, it's really high expressing yeast. You can make a lot of it. So our collaborators, our industrial partners, Biological E, BioE, and Hyderabad's making 1 billion doses and testing it now in India. So that's going.
So that must be delivered with an adjuvant. Is that right?
Yeah, it's on alum. We're looking at some other second immunostimulants as well.
Okay.
Cool. Now, all these vaccines, I'm not sure about yours, but I know certainly Moderna, Pfizer, AstraZeneca, J&J, everybody's developing these in adult trials, which certainly makes sense to a first blush. Do you anticipate pediatric trials coming at some point? And if not, what are we going to do about school reopening?
So Julie Banderas just asked me that on Fox News this morning.
Okay.
So the very question, see? It's just,
hey, Julie. We should have the step-down studies, I imagine, must be in progress at this point. Probably in adolescents first, and then little kids from there. Also pregnant women, that's going to be another population because they do very badly with this virus also. So that's got to move pretty quick. I mean, the problem with all this is all the communication is through press release. Right.
I mean, this is a terrible way to do it. I mean, the Operation Warp Speed, I think Moncef Slavi's done a good job in terms of this, and our NIH active group in terms of ensuring, a lot of rigor, scientific rigor in the trials, integrity of the trials, but there was never a communication plan. Like that Operation Warp Speed put in place. It was let the pharma CEOs, they're going to do the communication, and they've bungled it almost every step of the way.
Exactly.
Right? Between the pharma CEOs and the boards, right? I mean, you had all the stuff about the 2 adverse events that caused the pause. You heard about that through a leaked press conference with JP Morgan investors and all the Moderna stock dumping and trading that was alleged. And then you had it's just been one mess after another, and that could have been prevented if there had been a plan to get government scientists out there in front communicating about Operation Warp Speed. And I think that'll happen in the new administration as well. But that's the one piece that was missed. And now you've got at least 2 or 3 surveys from Associated Press and Reuters and the Pew Research Center saying up to half of Americans will refuse COVID-19 vaccines, even if they're made available. And I think that reflects the absence of communication from Operation Warp Speed was filled by either miscommunication from the pharma CEOs and their boards, and the anti-vaccine lobby that everything from Peter Hotez is trying to use 5G to implant chips into your neck, or
that's what that is.
You are?
Or
I should have turned on Fox News.
Or Bill Gates is doing this, or Tony's doing this. I mean, it's just, and that's caused a lot of damage. And then my colleague, friend Anne Ramoyne, UCLA, just had a paper put up on medRxiv. Even a significant percentage of healthcare workers, nurses especially, are going to refuse COVID-19 vaccines. And that also reflects the politicization that happened. And even just calling it Operation Warp Speed, I mean, who thought of that one, right? I mean, because what do the anti-vaccine people allege? They alleged other than vaccines cause autism, and there's the OG villain behind it. They say vaccines are rushed, not adequately tested for safety. there's a conspiratorial relation with the pharma companies and the U.S. government. And so everything that's been done is playing right into that. And so we've got to figure out a way to fix that pretty soon. I think people start getting vaccinated and they don't, it spreads around that they're not any untoward reaction, I think things will go better. But imagine the other side of this is, remember, even in a 30 or 40,000 person study, that's not going to pick up all the adverse safety events, right? With RotaShield, we didn't know about the intussusception till millions of people started getting vaccinated. You have to ask, you can ask Paul Offit, who would know better. But so there are going to be safety events that happen, and they're going to be really amplified, and how we respond to that's going to be very important.
Do you see any potential for mandatory vaccination laws? For example, my daughter she's in the cohort that's online school only, because I didn't like the odds of her going to the local school in the hybrid fashion. But for the kids who are actually showing up in person 2 days a week, they have to have a flu vaccine.
Right.
That was a new measure implemented.
So
I was pleased to see it, but I know there was a lot of controversy. And I'm thinking with COVID-19 vaccines, especially in cases like healthcare workers, one could very easily make an argument that this should be a mandatory vaccination situation.
That, and then the other idea that's been raised, should we pay people to get vaccinated?
Sure. Interesting.
I think right now we don't have to go there because there's not enough vaccine around anyway.
Well, right.
So I do think, and being the optimist that I am, working on something called neglected diseases or parasitic worms my whole life, is I have a feeling, I hope is that once people start getting vaccinated and people don't see any untoward responses to it, the enthusiasm will pick up. And if not, and if we have vaccines sitting in the freezer not being used, then we can start really thinking about incentives. I think for mandatory vaccination, again, that would play right into the hands.
Of course.
All you would need is General Gus Perna, the 4-star general, with a small army, marching. It's like, talk about make their day, right? So I don't think we're going to have to go there. The only exception maybe to mandatory vaccinations, for college campuses, my son had to have evidence. My youngest son had evidence of meningococcal vaccination. So there's precedent for that.
Well, and there's also precedent for the military.
Yeah.
Which I am fully expecting is they already make flu vaccination mandatory. And they have, military flu vaccination rates are approach 100%. For exactly that reason. So I'm sure that's a case where that can be done, but that's obviously a special legal category.
So Qantas has just made it mandatory that if you're going to fly on Qantas, you have to have a vaccine certificate. That's their new rule. So a lot of international flights are going to come up with that as a vaccine.
Okay.
Well,
vaccine passport.
Right.
Well, with your subcutaneous chip now that we've, you don't need it, right? It's,
Peter, give me one.
It's like when you get when a shelter animal gets picked up, you just scan for the chip and they find the owner.
Actually, I think as I pointed out on some previous episode, I'm old enough.
I shouldn't joke because there's somebody, one of these anti-vaxxers is
recording everything.
Is recording that part and editing.
That's right.
I'm impressed by all the power that you have here.
Yes.
There was a time in the smallpox era where you had to travel with your smallpox vaccination card.
Right.
Okay?
Yes.
I had one of those.
Right.
So, Peter, I think one of the most important things I've heard you say is this notion that the Biden COVID task force is entirely blue state representatives, because I think one of the most powerful voices you could get is people from the states that are most in need. Okay. To speak out and speak sense, talk sense.
Well, I think I don't really know the role of the task force yet. I think it may just be advice in the early stages.
Right.
I don't know what the plan is, whether that's going to be a permanent organization, or if it is, whether maybe this is just the first group of people that's been helping the president-elect, and they'll expand it. I just don't have enough insight to know what their role is.
But in the political realm, I think one of the most important things that's happened is state representatives, governors who are speaking up, saying the election was fair. That really, that really has an impact.
There's no question, if we want to deal with COVID-19, we are going to need Republican champions.
No question.
That can meet with, and you've seen, the governor of South Dakota being defiant, and other.
Well, you got Mitt Romney.
Governors. So that's right. That's good. I think that's a positive step, but we need, 20 of those to really
that's
help.
correct.
And we're going to need Republican champions to take and to undo all the damage from the Scott Atlas.
Governors and state health officials of one sort or another.
Yeah.
Speaking up.
Are you optimistic?
Well, the state health officials, though, have been, talking to them. It's amazing the intimidation that they've lived under. They don't feel comfortable speaking out in some states, and they've been muzzled, and that must be so exasperating for them.
So are you optimistic? Do you think with an administration change that will be lifted?
Well, again, one of the things that I learned getting into vaccine policy, fighting the anti-vaccine movement, is how much of this is regulated at the state level, not the federal level. And I would imagine that's also going to be true a lot with COVID-19 and COVID-19 vaccine rollout. It's very much in charge of the state. So this is what makes going up against anti-science groups so challenging. You have to do it times 50, because there's different forces and dynamics in each state. And I think that's going to be a challenge.
There is now, though, as a result of COVID-19 and as a result of the botched federal response, there's something of a precedent for a way forward with that, which is interstate quarantines. So, for example, I think actually none of you are welcome to come to Massachusetts right now, and I would invite you. But the state has decided that the only place you can visit from Mass or vice versa is, I think now
Vermont. Probably.
I think we're down to Vermont and Hawaii.
I don't know why.
It's been getting smaller and smaller. We used to have the whole Northeast that we could go and visit, but now it's just fewer and fewer states. And other states have done this. Connecticut has done it to Massachusetts.
I just don't think it works very well. But
no, it doesn't work very well. But it is something of a. This never would have occurred to me that you could have an interstate quarantine. Is certainly in the 21st century.
I think there could have been a federal response and federal directives. Right. It just would have, if Trump and Pence had gotten behind it, and picked up the phone with each governor and said, you have to do this, we would have been in a much better position.
Right. But we
would have prevented that summer surge. We could have really slowed down this fall surge to the point where wouldn't have really picked up till vaccines were just about here, which
right.
And I put out this thing called my October 1 plan over the summer to say just that, and sent it to the White House task force. Nobody opened it. I'm pretty sure it was just
right.
So despite
the tragedy is that there are people in the Republican Party that actually believe what you say, but they're afraid to speak out because their jobs are at stake, their constituency.
Well, historically, there was nothing about the Republican Party that was anti-science. NASA was founded in the Eisenhower administration.
Of course.
The George W. Bush administration launched PEPFAR and our neglected tropical disease program. So
Nixon created the EPA.
This is all sort of a twisted,
you got it,
new phenomenon.
This is all part of the Karl Rove era. Yeah.
That's
Peter,
true.
despite what you have said, what is the reason? I still do not understand why the administration did not do what you said they could have done. I understand all the science misinformation and distrust and
politics.
But what is the real reason they didn't do it?
I think the real reason, the disinformation, there was somebody, whether it was the president or his closest advisors, made a decision that the path to win the election was to deny COVID-19 as a problem.
Yes.
That by the time they realized they'd fucked us up, they made a decision that rather than regroup and do as a normal person would, right, which is say, okay, guys, we messed up. How do we fix this? Let's have a frank discussion with the American people. Here's what we're going to do. They decided to go the other extreme and just deny and deflect. And I think
you're dealing with.
But I think the first part, the more subtle question though is even before that, when there was that decision not to have a national response and leave it to the states, which was the first domino to fall, and missing the entry of the virus into New York. What happened there? How much of it was disorganization or the president's lack of interest versus internal failings in the agencies? That one's going to need to be looked at. And
you can hear him say that it's just like the flu. It's got a season. It's going to go away. Everything is going to be fine. Yeah. And I think at that point he actually believed it. He was that uninformed to think that could happen.
Yeah,
Peter. So what's your view on the resolution of this? I know it's hard to predict, but I'm sure you've thought about it. What are we looking at?
Well, I think the with the Biden in the U.S. anyway, the Biden administration getting up, if they can create that federally led response, that's going to be a help. And now we've got vaccines too, which is going to make it a little easier, provided we can get people to get vaccinated. So I see it evolving improvement. I think by the second quarter next year, we'll be in a much better place. I think by the summer, we'll even be in a better place. And by the fall, life will be, I wouldn't say normal, but, we're going to have a pretty good comfort level about how to respond. And so this will be, as Tony Fauci says, won't be lights off, lights on, but it'll clearly get much better. And so that's good news. And then we're going to have to start thinking about how do we readjust pandemic preparedness, especially because we've had a new coronavirus pandemic every decade of this 21st century. We had SARS in 2003, MERS in 2012. Now we're going to have COVID-26 and COVID-32, and how do we deal with that? And so we're already in discussions about how we would create a universal coronavirus vaccine, and what's the feasibility of that, and what's the role of AI and in technology platforms of helping with that.
Well, and in the larger sense, it's not just the coronaviruses. I mean, obviously they're a big concern, but there needs to be a structural look at how we approach pandemics in general.
And it's not like we didn't do anything, right? I mean, we had. Right. So after SARS-1, there was International Health Regulations, IHR 2005. That was important. And then when Obama came in, they created GHSA, the Global Health Security Agenda. And then, CEPI formed. And CEPI was formed, with Gates and Wellcome Trust and the Nordic countries, or the Norwegians and the UK, around knowing that we need some way to make vaccines and get them financed. And so even though it's started slowly, I think it's picking up now. So it's not like people didn't recognize this. The amount of resources being devoted to it are incremental from what we really need. And in the book, this Preventing the Next Pandemic, I make the plea that bring the G20 nations together, because it's still too dependent on a few players. It's too dependent on the US, the UK, that government that we call the Bill and Melinda Gates Foundation, and a couple of others. We need more input from the Chinese, and the Japanese are doing something now with the Jihad Fund, and the Koreans with a right fund that I'm on the board on, but it's still small potatoes. If it's not clear now that viruses are not just a public health threat, this collapsed the global economy, and it basically caused a security threat of unprecedented dimensions, undermining confidence in governments. Now's the time. We have to basically put the same energy and support we do for nuclear deterrence and other big picture things that we do.
Peter, I'm interested in your perspective on the recovery from this on a global scale. Is it going to be really uneven with some areas lagging way behind, or are there sufficient international efforts to sort of bring everybody out of this together?
Well, there is an international effort, and I think it's pretty well conceived. It came out of WHO and Kate O'Brien's shop and WHO and CEPI and Gavi and the Gates Foundation. It's called
COVAX.
COVAX Sharing Facility. And it's now the money is starting to come in. Boris Johnson, the UK government, just committed £571 million. The US still hasn't joined. Maybe it will in the new administration, although I think USAID's contributed about $20 million for it. So that'll get financed. Then the question is, how does it operationalize and what vaccines? Because, the Pfizer and I don't think Moderna's part of it at all. The Pfizer vaccine, I think, is, but, walking around with minus 100-degree Fahrenheit freezers in Ethiopia and Tanzania and Panama, it's doable, right? I mean, we did it for the Ebola vaccine for VSV, the VSV-based Ebola vaccine. That required freezing. I don't know what the temperature was, but it's doable. It's just more daunting. And then you have the problem of the COVAX sharing facility so far is only until they get up to full speed is only guaranteeing access of 20% of the populations for the countries in Latin America and elsewhere, according to some of the discussions I've had with Latin American leaders, with my science co-partner, Marielena Potazzi. We've worked together now for 20 years, and she's from Honduras, so we've been doing a lot of calls from Central America. And so what you're seeing now is they're making these one-off bilateral agreements or deals with the Russians for the Russian vaccine and some of the Chinese vaccines. So it's got sort of this Cold War smell to it, that old style influence. So we're hoping our vaccine can come along and make a difference. So I think, just like CEPI, just like COVAX, just like Global Health Security Agenda, there's a lot of good ideas coming out, and they're actually being operationalized. It's just that they are always under-financed, under-resourced to do what needs to be done. And then we're going to have to figure out how to take on this terrible anti-science juggernaut. And so far, no one has the appetite to do that.
So just for clarification, you were saying that the COVAX group is only planning to provide 20% of a population's vaccine needs.
In Latin America, it started it's because as vaccine becomes available, right? So and finance, so it's starting at 3%, then 20%. I think their aspirational goal is to get to 100%, but it's going to take time, right, to get there.
Yeah, there's not enough to claim 100% for everybody from the get-go.
Right.
Yeah,
So I think the other piece, the other recognition is, one of the things that I've, when I was in the Obama administration, 2015, 2016, I served as U.S. science envoy, focusing on vaccine diplomacy, trying to build vaccine development capacity. So right now, there's no ability to make new vaccines in the Middle East. There's no ability to make new vaccines on the African continent. There are, in Latin America, the Brazilians and the Cubans make some new vaccines, but they've had some issues. At least in Brazil, they've had some issues as well. So there's this over-reliance on the multinational pharmaceutical companies and some of the developing country vaccine manufacturers from India, which is supplying a lot of vaccine for the world. So the other piece to this is how we build out capacity for developing new vaccines in these huge areas of the world where there's no capacity currently. And and vaccines are tough because it's not so much the making the vaccine. So when Russia made Sputnik V or Sputnik 5, whatever they call their vaccine, I was asked about it, and they called it Sputnik, portraying this as a great heroic scientific achievement. It's not, as I say, the virus is a soft target. It's not that hard to make a recombinant adenovirus. The tough part's all the scale up, the quality control, and quality assurance, and providing doing phase 3 clinical trials under good regulatory practices and having a regulatory system of regulatory science for monitoring and following. That's the hard part, and that part is missing in many parts of the globe.
Peter, we've kept you enough, but I have one more question. Are those worms on the painting behind you?
So that painting to my left,
Yeah.
I've gotten at least a dozen letters now from people feel the need to write to me. I love it. So, well, the best thing that ever happened was a couple saw my bow ties and thought I could up my game of bow ties, and they shipped me some bow ties from Eden Ravenscroft, which is a Savile Row London tailor.
Ooh.
I wear them all the time. It's my first Savile Row garment.
Nice.
So that I love. So anyone who wants to send me Eden Ravenscroft bow ties, but the painting on my left. So I swear to God, at least a dozen emails saying, we've looked up that painting in our art books. We looked under Kandinsky and Moreau.
Looks like Anka Circa to me.
And Kandinsky, Moreau, Clay. We just can't find it. We can't find anything like it. We love it. And it was my oldest daughter is now a research scientist at UCLA. She has her PhD in developmental psychology. And she works at a center looking at a number of mental health issues. She did that in 6th grade. But my wife Ann thinks the assignment was to copy another painting. She just didn't do a very good job of copying it. But
it's an original.
It's an original.
From here, it looks great.
Yeah.
Peter Hotez, Baylor College of Medicine. Thank you so much for joining us, Peter. Appreciate it.
Thank you, Vincent. And I've said this before to you, and that is, what you're doing with this podcast is more important than maybe even you realize, because I think, we don't have good science systems of science communication in this country. We tend to either just use a lot of jargon that makes it incomprehensible. But the bigger mistake that people make, and this is what the White House Coronavirus Task Force did, was they dumb it down to the 6th grade or 4th grade level. Somebody in a journalism school or communication school in the 80s said, you have to talk to the American people like they're in the 4th grade or 6th grade. And they still stick with that and not realizing that with the internet and everything else, it's not the case anymore. And that's what the White House Coronavirus Task Force did with disastrous consequences. And so the nicest compliment I ever got was from my editor from Johns Hopkins University Press. He said, Peter, the thing about your books is you can explain complicated concepts in science without sounding like you're talking down to people. You're willing to take the time to go through the assumptions. Mm-hmm. And I think this is what you do in this podcast, which is so fantastic. It, people want to be challenged, but you do it in a way that really does educate. And I think this is one of the problems that the gaps that the anti-vaccine people are filling is that absence of science communication. So this kind of stuff you're doing is so important. I have a paper that came out last year in PLOS Biology. It talks about actually building in science communication into the DNA of PhD programs and postdoc programs and even medical residency education. Because we don't know how to do we're not trained to do public engagement. I did my, MD, PhD at Rockefeller and Cornell. That's when I first met Dixon. And that was one of the last of the great German universities where, you were, the message was you don't engage the journalists. You don't talk.
Exactly right.
You don't talk to the public. That's considered self-promotion or grandstanding. And
unless you're explaining why you got your Nobel Prize.
Or something like that. Exactly. Yeah. And I think that worked up until something called the internet came along and social media. And now we have to fix it, but we don't. It's tough because not only do we not have the scientists trained to do that, I think the academic health centers more often than not don't like it. They don't, they want to control the message. They're very risk averse. They're worried about protecting the institution, and they don't care if they don't necessarily want their docs and scientists speaking out about social injustice or going up against anti-science movements. So there's a lot of work to do. And then, when I get evaluated every year and then I'll let you go because I just want to make this, when I get evaluated every year on my, I do an annual form. What am I being evaluated on? I'm being asked on my grants, the grant support I have, especially federal grant support, and then my scientific papers. And then they want to know about my federal grant support and my scientific papers.
Right.
And they want to know my federal grant support and scientific
That's
papers.
right.
I mean, there's not even a place. There's no place on my evaluation form and this is not unique. I'm sure it's for even the books, single author books I wrote. Who cares?
Right.
And much less, the op-eds or the podcasts that I've done, or God forbid, social media. And so that there's no incentive to do it. Nobody can build a career on doing it. And,
right, you're right.
And so we've got to figure out a way how to incentivize.
You're absolutely right.
And young people want to do it. I'm sure every, postdoc and graduate student listening to this, they're all in, right?
Yeah,
The commitment
That's
of
right.
young people to public service
For sure.
is at an all-time high, right? And we're not capturing that, and we need to figure out a way to really build on that enthusiasm.
Yeah, I agree.
Right.
I agree with you totally. We try, but we mainly preach to the converted Peter, as you must know, right?
Well, but you're reaching young scientists, and I think them hearing that, and because they're probably saying,
right.
"Well, gee, when I try to write an op-ed or something like that, I get beat up for it."
Yeah.
And just to let you know, you're not alone. There's a fundamental problem in how we're doing science education.
Agreed. Anyway, Peter, next when your book comes out, why don't you come back and we can chat about it?
I would love it. This was great. I love you guys. You're the best.
Thank you.
We love you
Great
too.
to have you.
Thank you
Thanks,
so
Peter.
much. It's so cool
Good
to
to
talk
talk
with
to
you,
you.
to meet you.
Peter,
Bye-bye.
you should talk to Daniel Griffin about his bow ties before we leave. You should see what he's got on them. They're all microbial. Every one of them is a microbe of some sort. So I think you're behind the 8 ball here.
I've got some fun stories, not suitable even for a podcast. So we'll talk about that.
Bye-bye.
Bye-bye. Thanks,
care. See ya.
everybody.
Bye.
Bye-bye.
I think Daniel should send him some.
Oh, I agree
They should
with
have a
you.
bow tie exchange.
They should have a bow
Yeah.
tie exchange.
Yeah, for sure. I
Well,
know.
that was about as spontaneous as it gets.
That's
That was
fabulous.
great. Yeah, no, it's great.
He's wonderful. I've known him for so long, and he's always been the same person.
I also.
But did you
think,
notice the
though,
size of his cup that he was drinking
Huge, huge.
from? That's a normal size cup. He's
What was I going to say? I think he enjoys free form chatting.
He does.
As
Yeah, he does.
opposed
He
to
does.
a series of questions and there's no back and forth.
Yeah, you're right.
You know,
You're right.
Yeah.
You're right.
which is
You're
great.
right.
Now, Brianne, you remember
Yes.
the paper we discussed on Wednesday about
I
protein
do.
Oh,
vaccines?
yeah.
Yes,
And
I
I
Germinal
do.
was thinking about
centers.
that.
I
billion
do. I was not
doses.
mentioning that.
No, I wasn't going to mention it, but it could be a problem, right?
Could be a problem.
Yes.
So, Alan, this paper we did, they compare mRNA with protein-based SARS-CoV-2 vaccines in mice, and the protein-based vaccines don't make any germinal centers, and the mRNA
Really?
vaccines do.
Mm-hmm.
And it's-
Even more than that, it was a receptor binding domain
Yes.
protein vaccine.
Right. Exactly.
which is what he's got, right?
adjuvanted.
So we-
Correct.
Yeah, and
what
we
is that?
and we were talking about the difference between receptor binding domain only versus full spike
Right.
quite a bit.
Right. So one question I have about the mRNA vaccine that I've never heard discussed is when you inject the mRNA into your arm, where does it go? Which cells end up making the actual antigen?
TWiV 685.
Okay, I didn't hear that one.
Brianne, yeah, we talked all about it.
Brianne, go for it, Brianne.
Yes.
Do
so
it anyway.
there are kind of 2/3 places where it ends up. One is that you transfect some local muscle cells.
Yeah.
There also are some local dendritic cells that can get transfected and then head to the lymph node.
Okay.
And there'll be some of those local muscle cells that will get transfected and then die because of the stress of kind of trauma of getting injected, and they will
Right.
get phagocytosed by some of those dendritic cells.
Sure. So when you inject, how much of the mRNA actually gets into cells? Do you know that one?
That is much harder to do. There are a couple of studies people have done where they look at protein production
Yeah.
With DNA vaccines, but I haven't seen the same study for the mRNA vaccine.
Oh, okay. Just
Those studies, I'm sure, exist.
I'll still take it. Believe me, I'll still take it.
Here, Dixon, I'm going to give you a little seminar.
You do that. This is for everybody else too, by the way.
I just want to give you this is a talk I gave to Google the other day, okay? This is the slide, which is actually from Moderna. Hey, let's try this this thing.
Yeah, can you highlight?
What is it called?
Or spotlight?
Where do I get that? More? No. I have to click on it maybe? Oh, yeah, my spotlight for everyone. So what happens when I do that?
Oh, that's very good.
Then it is spotlighted for all of us.
Yep.
It's cool.
Anyway, here you go, what Brienne said. So Moderna is saying it goes right to the lymph nodes in the armpit, right? But it could also, as she said, infect. And then
it probably goes in some cells.
And then these APCs, they pick it up, they go in the lymph node, and they're in it. The RNA is translated, proteins processed, presented to T cells, right, Brienne?
Exactly.
Apparently it works really well.
So does the protein that gets produced not in the germinal centers eventually end up in the germinal center, so antigen presentation, or does it just get degraded?
So those antigen presenting cells will start to seed a germinal center and present to some B cells.
Okay.
Or have antigen that can be presented to B cells.
And do we know how long protein synthesis occurs before the thing burns out?
We don't, and I think that would be related to the nanoparticle formulation. That's proprietary.
Right.
But
okay, so Brienne, I'm going to ask a question. We've done this before, but I want to do it again.
Okay.
We got part way there last time, but I'm still a little puzzled. There's a fundamental difference between the immune response to a protein that is made in the recipient compared to a protein that is delivered preformed, right? We talked about this. If you have a protein vaccine, in particular, that is skewed TH2, right?
That's some TH2, yep.
Whereas made on site, it's more balanced TH1, TH2.
That is what they saw in that paper, yes.
Okay, why?
So I think there are two pieces to that. One of them is that there is a difference in how proteins get onto MHC class 1 when they are coming from the cytoplasm and when they are coming from an endosome or a phagosome. So if they've come from outside the cell or inside the cell.
Okay.
The path to put them on MHC is different.
Okay.
So that's one part of it. So a protein that's made outside the cell is going to get onto MHC through a different route.
But in the end, the recognition is this thing on MHC, right?
Right. Yeah. The other piece of it is that if you remember, I mentioned the antigen presenting cell is going to make some cytokines when it talks to the T cell.
Right.
And that will influence what kind of T cell the T cell becomes, what flavor of T cell it grows up to be. And the formulation of the antigen at the beginning could influence what that dendritic cell does in terms of making its cytokines.
Okay, so another question in both. This is. I'm sorry, gang. I'm straying here, but this challenges me. By the way, I've started taking Brienne's immunology course. So, all of these antigens get presented after processing, right?
Yes.
So, what is a conformational epitope? Okay, I think of this as a three-dimensional thing, like on a virus-like particle or something like that. And I think of the process thing as being a peptide associated with MHC. So how do you preserve a conformational epitope via the processing and presentation?
So that's a great question. Conformational epitopes are really only a thing for B cells and antibodies where the protein or other molecule is still folded.
Okay.
You don't see conformational epitopes with T cell responses. You see what are known as linear epitopes for exactly the reason that you're mentioning, because the protein has to be unfolded and processed.
So for a conformational epitope to generate an immune response, am I talking then about a B cell, the relatively naive B cell, perhaps actually directly recognizing that particle or whatever it is that has the confirmation.
Yes, exactly.
So no processing.
Right.
Excellent. Cool.
I have a question too, though. When ordinary proteins are made inside of a cell during mRNA translation into proteins, the protein stays inside the cell for the most part. Maybe it's a structural protein or it's stored in a particle or something like this. Why does the spike protein get extruded from the cell? Is there a signal that's built in to this little piece of RNA that tells the cell, oh, this is a different protein. What you're supposed to do now is to put it outside the cell.
Oh, so when you say extruded from the cell, do you mean put on the cell membrane?
How does the protein get out of the cell? Because why should it? Most other proteins that the cell makes don't get out of the cell.
Right. So this protein doesn't necessarily get out of the cell either. It is either presented in that original cell that made it, or the cell dies and is phagocytosed, and the phagocytosing cell.
Like I was thinking of muscle cells because I'm really familiar with muscle cells. They don't degrade very fast. The satellite cells do, though, however. So it's possible that the satellite cells might play a big role here. So I see what you're saying. Then it's like an antigen reserve almost. As soon as the cell exceeds its lifespan, releases the proteins, and that's like a little boost. Do you think that's what's going on?
I'm not sure how long-lived that protein production would be. Right, and I think it's just that I just don't know if I've at least seen the experiments to answer that.
Every mRNA has a different half-life, and I don't know if they've tried to optimize this one, right? Because you can fool around with sequences and non-coding regions.
Or how much gets into each cell. I mean, it's not just one molecule.
Well, that's
isn't the important thing? The important thing is just that it gets expressed in the cell, and any protein that's being expressed in the cell is going to get MHC presenting some of it on the surface because that's just what MHC does.
Exactly.
Right?
So,
but also, this is what's going on inside.
I mean, a fraction of it will also, remember, this is a spike protein. It's a plasma membrane glycoprotein.
Right.
Actually, it's not a plasma membrane. It's directed to the ER Golgi membrane. So it's got transport and membrane adhesion sequences, right? It's got a transmembrane sequence. So just the spike alone, even if it were not processed and transported by MHC, would still get to the cell surface.
On the surface.
By virtue of it being a membrane protein,
Right.
It has
that will help.
Transmembrane motif?
It does have a transmembrane domain, yes.
Sure. Now,
so that would help the B cells, and the MHC would help the B cells.
Yeah, so cells, an APC with, Brianna, an APC with spike on the surface, full-length spike, could interact with a B cell, right?
Perhaps, yeah.
And so if there were an antibody on some B cell that recognized it, then it would proliferate and cause.
That's the other thing I like about synthesis on site is it seems to me that there's a good probability that you'll make something that has the correct conformation and modifications and presentation if it's as the full-length thing, as opposed to taking some purified protein and emulsifying it and injecting it.
Right. So in follow-up now, then you need 2 injections 2 weeks apart. What's going on there?
So that is kind of seen in a lot of different types of vaccines. And I think the idea is that those T cells need to be primed. They need to see the antigen more than once in order to get a response that's amplified and differentiated to memory before you can get over a threshold amount to have a good response.
So
graduate school. The T cells have to go to graduate school.
In the phase 1 and 2, they did measure antibodies, after the first and second doses. And it goes up for sure. But the question is the first enough to protect? And they didn't know, and they don't know from this trial because they're just checking after the second.
Right.
So you might need only one. I would say
is the first response IgM?
IgM is always the first antibody type that you make early. You will switch to IgG even after even during that response to the first.
So the second boost is actually to boost the IgG levels.
Yes.
Then. Okay. Fine.
Right. But it's possible that with your initial dose, somebody might then go out, get exposed to SARS-CoV-2, and that infection would then provide the boost.
Same.
The question
That's right.
and what the trials did not look at was whether it's safe to do that. Do you have enough immunity to not die by having
Exactly.
that be your boost?
Yeah. So since we don't know what the threshold is, we're kind of going with the better safe than sorry approach of really boosting that immune system well.
Got it.
Yeah, this whole idea of a boost is dicey with these virus vectored vaccines. You know, we saw from the AstraZeneca that maybe giving a full first dose is not good. Or is there a company? Isn't one of the companies? I think J&J is doing a 1 dose adeno.
I think that's 1 dose. Yeah.
Yes,
because that.
Yeah, they're looking at a 1 dose. I don't know if it'll end up being a 1 dose.
And the Russian vaccine is 2 different adenoviruses.
2 different vectors.
So that gets around that. And that's smart. In retrospect, that's very smart.
Yeah.
So
what about an annual injection?
Yeah, what about it?
Sure.
From 2, you've got...
yeah. How much more do you want to pay?
Well, we're not going to pay anything for the first one.
Well, and we don't actually know how long the immunity to this is going to last. We've got a lot of papers coming out about how long it might last, how long it might not last.
That's right.
But, we've had less than 2 months of experience with these vaccines.
No, I hear that. I do hear that. I hear
well, speaking of less than 2 months, there's a bloody article in the Times today saying that the virus is mutating more than anything we've seen. It's going to mutate away from vaccines. Where the hell are they getting this from? Where are they fabricating? This is a Carl Zimmer story. Please. It's not mutating more than anything. Give me a break. It's 9 months, for God's sake. How can you make these general conclusions? And the virologists, they quote, don't help. They don't say, no, you're wrong. Or maybe they didn't. He didn't write that.
Right.
Right. They don't like hearing, I don't know.
But, the Shane Crotty thinks from natural infection anyway, immunity might be long lasting. So who knows?
Right.
Well,
but then we've also got people getting reinfected.
Yeah.
So
someone should do a virology podcast. This is all very interesting.
Yeah,
it really is.
People sitting around talking about this.
There's one final thing I feel like I'm feeling somewhat compelled to say.
Yeah, go ahead.
Because of a past email I received after one of our episodes. And so that's just Dr. Udell. I apologize for oversimplifying MHC Class 1 presentation and not discussing aspects of some of your work. And I am more than happy to discuss more of it with you with that email.
Well, I'll tell you what, next time he comes on, we'll make sure you're on and you guys can chat about it.
Yeah.
I really liked emailing back and forth with him about presentation.
But this way we could learn from it too, When you guys email, it doesn't teach the world. All right, let's do a few email here. First one is from Nick Atchison, who's a virologist up in Canada. What is it, the Great White North? Is that what Canada is?
Yes.
Called that, yeah.
Hi, TWiV guys. Look at this opinion piece published November 17th in the Globe and Mail. It suggests making rapid antigen tests available across the country, 1 million per week for 33 million residents. Why don't more people understand how this approach could be a lifesaver? The second author is chair of my department at McGill. So I don't know if this is just making its way to the frozen north, this idea. This is the Michael Mina approach, of course, cheap, rapid antigen tests. And, we're waiting. I think it's a great idea. We'll see what happens. Thank you, Nick. Brienne, can you take the next one, please?
Sure. Tim writes, hi, Vincent. I am a pre-COVID TWiV listener and love the work you do. You guys give the science facts a thinking person needs to be able to reason about the risks of COVID. TWiV forms the meaty filling in a news media club sandwich of left-wing, right-wing, topical filling, and off-the-wall relish. I, like many others, have had to create this media diet sandwich to try and make sense of the world, as left and right mainstream news seems to be more fear-driven counter-narratives and political talking heads than informative journalism at the moment. The relish in my sandwich is a global news analysis show hosted by Adam Curry, the creator of podcast technology. It is similar to TWiV in that it is donation-funded, analysis-driven, relatively impartial, unique in perspective, and fascinating in content, which is also shared with the listener in the show notes. You are constantly Racanielling rhetorical questions on TWiV, like, I still do not get why it is politically motivated on episode 674 at 1 hour, 1 minute-ish. Or where do they get this stuff? This show may answer some of your questions. If nothing else, you should check out their time, treasure, talent, donation, participation business model, as it has kept them running for more than 12 years. And I think TWiV can do something similar. I guess that would be time, treasure, talent.
Talent, I think.
Yes. The show is called No Agenda, and episode 1290 has a clip from TWiV. In this episode, they use a clip of your interview with Fauci, where you ask the question about PCR cycles, and he says anything above 35 cycles is not useful. This is important to their analysis because of their assertion that WHO guidelines are 40 or more cycles, which they cover in the previous episode 1288, which, if true, is concerning. And he gives a link. The clip is used in reference to their controversial assertion that for some unknown reason, the PCR testing guidelines given by the WHO seem to be wrong and erring on the side of global lockdown. An overview of their evidence is here, and he gives a link. I think this is something that the TWiV team can easily address, having better sources for testing guidelines and a science-based perspective. Thanks again to you and the TWiV team for all you are doing. Best regards, Tim. And so he has a couple of links here, one of which is called The Trouble with PCR Tests, which I hadn't really looked at before.
Well, first of all, in this article, they reproduce a very nice graph from a paper out of the French group where they compared, and I talked about this on my PCR video, they compare the CT value in different patients from like 11 to 37, and at the same time they tried to isolate virus in cell culture. And so they say, look, at PCR of, let's say, a CT of 35, we got 3 positive results in cell culture. But they don't show actually how many they checked, okay? They cut that off the bottom. And that's important because they only checked 3 or 4. And then at cycle 36, they don't get any infectivity in cell culture. So the point here is that depending on the lab and the PCR machine and probably other things, 37 in one lab is not going to be the same as a 37 in another. So you need to be a little bit flexible in your cutoff. So if WHO says 40, that above 40, you're not likely to be infectious. Fine. If you want to make it 35, that's fine too. You know, Trump had 35. That's why the press office said he's no longer transmissible, and that was probably fine. So I don't think this is an argument, whether it's 35 or 40. And if Adam Curry wants to focus on that, that's a waste of time, folks.
Yeah.
Yeah. If someone was going to report a CT value to me for a diagnostic test, I would want some additional information about their lab and the range that they see and their test. I wouldn't just care about that CT by itself.
And that is why they don't give you the CT values, because they vary a bit. They don't want you to make any diagnostic decisions. Yeah. However, when I had my PCR test, the lady called me on the phone and she said the CT was, I forgot what it is, 37.4. I don't know why they gave it to me. Apparently me and Fauci can get CT values.
Because they know you're a virologist and you'll understand it.
So it seems to me that there's at least 3 different numbers that are relevant in this. One is this, actually 4 different numbers. One is the CT value. The other is the RNA copies. How many RNA copies does that CT value represent? The other is the actual quantity of infectious virus that's associated with either of those. And the other is contagion, right? Which is beyond whether or not you can isolate virus from somebody. It's whether or not a certain amount of virus makes a person contagious. And those data you get from, who was it that wrote in recently, wanted us to pluralize? It was Jens. Jens, you're talking to the data plural guy here. Those data.
I'm down with data plural too.
Yeah. Those data you get with contact tracing. Okay. So to get the full spectrum of numbers, from CT value through RNA copy, through are you shedding virus, through are you contagious, I don't think anybody's done that in one study, and certainly not enough, not with enough people. There are pieces of it out in various places. So I'm not personally convinced that you have real hard numbers for all of this. Plus, as you guys have been talking about, Joe's CT value might be different than Mary's CT value. People are always looking for something that's black and white, and none of this is black and white. A lot of it is gray, especially on the fringes here. So chill out, okay?
How about if you did the same test on the same person with the same sample 3 times, you're going to get 37 each time? I don't know. I doubt it.
Same sample?
Yeah, I think the issue here is the show No Agenda
sample
actually has one, and has brought it to bear on an issue that can be interpreted in a few different ways, and so they chose to interpret it in the way that matched the argument they were going to make.
Just to note, Adam Curry is not a virologist, not a scientist, actually. I appreciate that he was a leader in podcasting technology. That's computer science, I guess, right?
Yeah.
Dixon, can you take the next one?
I can. Debbie writes, if I recall correctly, you mentioned face masks with copper in TWiV 685, and I see that you've covered this topic in earlier episodes as well. What do you think of this alternative? And Debbie writes from Edmonton, Alberta. I guess that's at the University of Alberta in Edmonton. And they are now using salt as an inclusion material in masks. I think if you don't lick it, it's probably okay. I don't know. What do you think?
Well, they say here that this seems a little absurd, okay? That as liquid from the droplets evaporates, the salt crystals grow back as spiky weapons and inactivate the virus. That is ridiculous. Come on, it's too small to be inactivated with any spike.
I don't think you can stab the virus to death.
No, you can't do that. You can't do that.
Maybe
Besides, it's covered in spikes itself, right?
It spikes back.
Now, probably this has probably got dumbed down for this article.
Yes.
But maybe the high salt inactivates infectivity in some way, not having to do with
that
spike.
I would believe.
Right.
Well, I don't know. It's not a journal article. I can't evaluate the data, right? I would love to see the paper.
I've got some skewed, totally irrelevant comment to make about sickle cell anemia and malaria. And when the sickle cell sickles, the hemoglobin molecule crystallizes and actually does stab the parasite.
Yes, it does.
That's a much bigger parasite.
So we have an example in nature of at least that happening once, but I don't think
the scale of that parasite.
That's right. Exactly right. Exactly.
And I think the scale of the hemoglobin might be a little bigger than.
Yes.
This is all true. This is all true.
All right. Rich, can you take the next one?
Perry writes, hi, TWiV team. This is the original story on the half dose. We talked about this last time, where the AstraZeneca vaccine was given at a half dose for the first injection to a subset of individuals. And we fingered that as, let's call it a serendipitous discovery. It was the initial UK participants in the 1855 group. Oxford scientists accidentally give patient wrong. Oh, this is the title of this article in the Mirror. Oxford scientists actually give patients wrong dose in coronavirus trial. And he gives a link to the article. Regards, Perry.
So we had originally said it was Brazil on Wednesday, right? But that's not true, apparently.
Okay, according to this, right.
It's in the UK. And, the article we were referring to on Wednesday blamed it on, trial participants in Brazil. But apparently they did it in the UK and they didn't formulate it correctly. Oh, well.
Yeah, that trial, as you note, is catching some flack about this.
So Paul Offit is quoted in this article, who Peter Hotez mentioned. At this point, the Oxford researchers have no idea whether they have something or not. I don't know if that's actually true, but
Yeah, no, I mean, we don't have any idea whether they have something or not. A lot of this is just data not shown, and and the way AstraZeneca and Oxford have handled the data on their trial is very different from the way Pfizer and Moderna have handled their data.
Yeah.
And I think that they need to get their act together in a hurry at this point.
Yeah, in fact, when we talked about it on Wednesday, we didn't realize that there was a lot of obfuscation going on by AstraZeneca, and that's unfortunate. So we will have to wait for the paper.
Yeah, I think we need to see a bit more data before we can totally understand what's going on in this situation.
Alan, can you take the next one?
Sure. Anonymous writes, the culled animals are mostly buried in waste incinerators. I think this is about the mink.
In Denmark,
gotta be.
At some point, they ran out of capacity and buried some mixed with lime on some government land, military base, I think. There have been a few cases of botched culling. Happens when you rush a lot of people into service, I suppose, but very unfortunate and does not make for good PR. Despite the lack of legal authority, the voluntary culling is mostly over. The farmers were promised a premium if done by Monday and are almost done. They will undoubtedly get compensation. Testing is proceeding in the affected region, but slower than I expected. Sequencing has not found any new cases in cluster 5. I guess cluster 5 was the mutation that appeared to be mink adapted.
Yeah, there was one that may be there was one that was of particular concern that had 4 mutations in it that, what was the deal? It didn't react as well with antibody.
Yeah. So far, the population has had very high confidence in the government's handling of the pandemic. Works in places like Denmark. The confidence has taken a major hit due to the mink scandal. The high confidence is why the use of strong recommendations instead of legal mandates for things like isolation, quarantine, travel restrictions, etc., have worked so well. There is fear that the reduced confidence will mean reduced compliance. I sure hope not, but we shall see. P.S. Something like 12C 54F outside was a nice, mostly sunny day. Continuing, the Minister of Food, Agriculture, and Fisheries has resigned. There may be further political fallout. After all, the culling order was clearly illegal, as has been admitted by the government, and there are further problems surfacing. The cost of the culling is guesstimated at $2 billion US. Scaling by the GDP, that corresponds to about $120 billion US if it were in the US. Not exactly pocket change. There are, it's interesting you use the phrase, there are further problems surfacing. Of course, there are also dead mink surfacing now, as I'm sure many people saw in the news. The zombie mink infected with mutant virus rising from the grave type of thing. But what's actually going on is that because these were hastily slaughtered and buried in shallow trenches, normal biological process, the decaying corpse will produce a certain amount of gas from the bacterial action, and some of them are ballooning up a little bit out of the ground just through that process.
Cool.
Yes.
So Anonymous is the person in Denmark who has been supplying
us with feeding us
news.
information about the mink situation. Yes.
Okay. Should we go to picks or should we do one more round? What do you think, folks?
Well, I'm game. I'm okay.
Alan, we could go either way.
Do one more round.
I can do another round.
Okay, so Bradley writes, I've read through the Pfizer and Moderna protocols, and if I understand them correctly, it seems you are seriously overestimating the potential impact. For example, Alan said the only way out is a vaccine, and Vincent commented, if there's a vaccine, there might not be a COVID chapter in the next edition of the Virology textbook. It appears that the vaccine studies are powered to detect a 60% reduction in the number of symptomatic cases. For the Moderna study, you need 2 symptoms, some pretty nonspecific, such as chills, myalgia, headache, while for Pfizer, you need only 1. Prevention of severe disease is a secondary endpoint, and I can't figure out what they predict that will be. Even if that is a 50% reduction, somewhat similar to flu, is that enough? Only 100,000 deaths a year in the U.S., over 1 million cases a year. If it is approved for prevention of disease, they might want to extend the trial to collect more data, but how many people would want to continue when they could easily get it? It may be years before that happens. When HIV was the most important human infection, there was an outcry that we needed a vaccine. What's happened is that the therapeutics are so good that in developed countries, treatment is no more complicated than that of diabetes or hypertension, and is a chronic disease. Prevention of sexual acquisition is achieved by 1 pill per day. Note that I'm not an anti-vaxxer and think one of the most important dates in human history was May 14th, 1796. I think we need to be clear about what we may be getting. So that must have been Jenner's trial, right?
Right. Yeah.
Yeah, that was Jenner.
All right, HIV, people are trying to make vaccines.
Yeah.
And to quote or parrot Kathy, comparing coronavirus with HIV is comparing apples and wrenches.
Yes.
Okay.
Apples and wrenches.
It's a like a totally different beast. We're talking about a virus that establishes latency. We're talking about a long-term chronic infection. We're talking about a virus that is extraordinarily good at evading immunity. Okay. So all of those speak to a condition where the best approach ultimately is, at least so far, is going to be drugs as opposed to vaccines. This is completely different. It's a quick, acute infection from a virus that apparently has one serotype. And I appreciated Peter's thing about the spike essentially being low-hanging fruit. I've been thinking about this. We lucked out, folks.
Yeah.
Okay. I think Spike, he called it a soft target. I think we got lucky. I mean, it's not over yet, but there's not a lot of antigenic variation. It's a really good neutralization target. Okay, so a vaccine is the best approach as opposed to drugs.
And
I don't think we were that hyped on what a vaccine is going to actually accomplish, right? I mean, we've talked about this. This is not going to be an overnight, now we've got a vaccine, it's all done, right?
Right. I think it's hard to really say what's going on until we see some data.
Yes.
On what those vaccines are actually doing. And I will say that, I think an HIV vaccine is and would be very important. It's just we've realized the level of challenge.
Yeah.
That's a huge challenge.
And so we're still working on it, but it's not the sort of soft target that some of this virus might be.
Actually, it'll be really interesting, assuming that we eventually get an HIV vaccine, to see what that will be.
Yeah.
Mm-hmm.
Okay. Because all of the traditional approaches have been unsuccessful. Okay.
Hey,
so
maybe they ought to try mRNA, huh?
Yeah. I think they have, but we'll see.
Somehow you got to get around the antigenic variation.
Yeah.
That's
so
tough.
These comments about severe disease, maybe this email was before the two companies reported that the vaccines are very good at preventing severe COVID-19.
Yes.
Which was not.
And I think we've said we're so far we got small numbers and no peer-reviewed publications. Yeah. Okay. Everything looks great, but we're still waiting to see a complete set of data.
We want to see the data.
Okay. So here is an mRNA vaccine, an experimental mRNA vaccine against HIV. And this was published in August. It protected non-human primates. So they're working on it. Yeah. Mm-hmm. That's a good idea.
What was it against, the GP120 or?
Yeah, probably. I didn't look, but I would guess, right? Because that would be a soft target, Dixon.
I would, so to speak.
Yeah.
Although in the case of HIV, antibodies are not necessarily protective. I mean, that's one of the big problems we have with HIV vaccines is we don't know what the correlates of protection
The organism hides in your own genome, so that's pretty sinister.
I think I would be interested to see exactly which version of the immunogen they were using there.
Right.
Well, with HIV, you don't mount an immune response and clear the virus, right? It's a whole different story.
You do mount an immune response and knock the virus down substantially.
Yeah, right.
But you can't get rid of the latent reservoir.
Yeah. Right.
Yeah, once that's established.
Then something comes back that can evade the immunity that you just established.
Right. But the latent reservoir gets established in about 2 weeks. So if you have a vaccine that would prevent that, you could then you get around it.
Then you could beat it. Yes.
Then you could beat it, and you wouldn't have any antigenic variation to worry about.
Exactly.
And guess
but you've got that one shot. Right. If it doesn't prevent the latency establishment, then
that's
you're
right. Guess who did that mRNA vaccine for HIV?
I have a pretty good
I'm
guess.
going to guess Moderna.
Yeah, you'd be right.
Yeah.
Yes, the spike proteins of clade B, which is the most common clade in U.S. and Europe.
Okay.
Is that you, Dixon?
What for what?
The
Sirens.
Sirens.
We're
No,
hearing sirens.
not this time.
No,
Not me.
not me. I'm in a basement.
Holy cow, it's not me either.
I don't hear it.
It's not
Someone's
me.
zooming. Someone's, what do they call it?
Zoom bombing?
Zoom bombing us. Go
Maybe.
away.
You're only getting sirens in.
Brianne, can you take the next one?
Sure. Lauren writes, and Lauren is a participant in the Moderna phase 3 trial. So giving us some information about that trial. Following up, there was no nasal swab or saliva collection at my last visit with the study, but they did do nasopharyngeal swabs on both days I went in for the shots. So I think that was about our question about whether they were testing for virus with nasal swabs.
Yeah.
I didn't know any axillary lymphadenopathy after the shots, but that is definitely one of the main things that they asked us to pay attention to. The study's symptom tracking phone app asked about it every day for a week after each shot. That's cool.
Okay.
I will pass your assay suggestions. I will pass on your assay suggestions the next time I talk with the study, which should be in about a week or two. They call a lot. Keep on TWiVing, Lauren.
Great.
So we read her letter last time, so she described what they were doing. I don't know if I mentioned this, but when did we do TWiV Wednesday? I might have. But many of these vaccine trials, they're taking blood and they can look for antibodies against other viral proteins other than the ones in the vaccine. And that way they could know if you're being infected afterwards by, if it's preventing infection or not.
Mm-hmm.
Rich.
Pauline writes, a question has been buzzing around in my head, now louder since listening to your discussion today of the paper on Neanderthal DNA, SNPs, ABO blood groups, and a suggested association with more severe COVID disease. I am not a medical professional or even a scientist, unless you count social science as the foundation of law. But since discovering TWiV and the TWi discussion clusters, I have come back to the unpoisoned well again and again for enlightenment, and I do my level best to keep up. I started reading about ABO blood typing, as you do, and discovered transfusion-related acute lung injury, TRALI. Transfusion-related acute lung injury, TRALI. Acute because the course of TRALI is short, nasty, and pretty deadly. Its severity appears to depend on, among other things, the blood type of the unfortunate receiving the mismatched blood product. Thing is, to my uneducated eye, TRALI looks a lot like the acute respiratory distress syndrome some people get with SARS-CoV-2. There are differences, of course. For example, I have not read that SARS-2 disease will cause bloody sputum or that destruction of red blood cells is observed. But there are similarities like clots in the lungs, ground glass opacity in the lungs, and kidney failure. There is no treatment for TRALI, it seems, except time and organ support and ventilation. So my question, and please forgive the depth of ignorance from which I ask, is it possible that SARS-2 virus is carrying something in its nasty packet that looks like mismatched blood to the body? I recall Vincent saying SARS-CoV-2 looked like a virus that had gotten into the wrong host. Could the viral packet be carrying a protein that a bat would happily accommodate, but once introduced to a susceptible human proves to be an impossibly grave insult? Diesel in the gasoline tank. Nice metaphor there. I like that. Are TRALI and ARDS simply two different terms for everything that goes wrong with lungs, generally with rapidly advancing lung disease of any kind? Could exposure to transfusions or blood products in the past set someone up for severe COVID? Could pregnant women who get COVID by virtue of the fact their immune systems are already negotiating with a little foreigner hooked up to the grid have protection against severe lung disease? Are the COVID-infected women who do better than male counterparts actually women who have had at least one pregnancy? I guess these are downline questions. Google seemed to think about 25 million Americans each year receive some type of blood product. That was more than one question, she says. Thank you for your exceptional work. And by the way, I do believe, without evidence other than my own experience, that gardening is emerging as the single biggest therapeutic to COVID angst. So please continue. And I would like to know what virus attacked and killed my zucchini plants, please. Best regards from a member of the Great Uncoiffed, Pauline from Montreal. 8 degrees C and overcast. That is a delightful letter.
That is a wonderful letter.
Yes.
That is a delightful letter. Thanks for the compliments. I'm all over the gardening thing. I totally agree that gardening is the path out of the pandemic. I think now I'm, not the expert either. But I think, so in Trally here, we're talking about basically being transfused with the wrong blood type, right?
Yeah.
And my guess is that's like totally different than
the mechanism is totally different.
SARS-CoV-2.
Yeah, the mechanism's totally different. The only kind of thing that seems to be in common from my brief reading of Trolley, where I had to become an expert while Rich read the letter, is that they both do involve kind of the innate immune system making quite a few cytokines. But everything that happened in order to push the innate immune system to make all those cytokines is pretty different.
And why you're seeing things like red blood cell lysis is because the red blood cells are foreign. So
in Trolley.
Yeah. Right. Whereas in COVID-19, you're seeing the downstream effects of an immune response run out of control for likely other reasons. But these are interesting questions, I think, about the pregnancy line of questioning is pretty cool because there are major immune changes that happen during that. And what we are seeing is that pregnant women are at unique risk from COVID-19, both they and their babies, and it probably depends on how far along the pregnancy is and how much their immune systems have changed. And then in terms of whether women with a past pregnancy have a different risk profile from women who don't have that, that's an interesting question for an epidemiologist to look into if they've got the data.
That's a really cool question. There are some other situations where we know the immune response is changed by pregnancy, and women who have had at least one pregnancy have different profiles of those immune-related diseases. So I hadn't thought of this question before this letter, and now I think it's a really cool question, and I hope someone looks at it.
Yeah.
I love this image of the pregnant woman as the little foreigner hooked up to the grid. I'm making my way through all of the Star Trek series, and one episode of Voyager had a moment where a woman on the bridge passed out, and somebody comes up with his tricorder, is checking her, and he says, "I'm reading 2 life forms here. Could it be a parasite?" And the doctor comes and examines her and determines that she's pregnant.
Yeah, when you hear hoofs, what do you think,
Yes.
Horses or zebras?
It's parasitic, but it's not a parasite.
Yes, right.
And by the way, the woman in Montreal, in the wintertime, Alan, what do you think she'll grow? Because gardening in the winter is pretty difficult, isn't it?
I don't think she would grow anything in the winter in Montreal.
Oh, yeah. She can make iceberg lettuce.
Thank you.
By the way, Pauline, stick around and we'll talk about your zucchinis once the pandemic is over.
Right.
So I just want to briefly address the diesel in the gasoline tank, just to clarify. She says, could the virus be carrying a protein that would mess us up? And, it's kind of similar. The genome encodes proteins that are doing things in us that they probably wouldn't do in a bat, basically.
Yeah, good point.
Okay, that's fine. Dixon, can you take the next one?
I can. Kevin writes, "Hi, TWiV. I'm a relatively new listener. I found the TWiV podcast back in April as I was trying to become better educated on how to run my business in the midst of this unprecedented time. So first off, thank you. I have learned a lot listening to your show and have found it an incredibly well-balanced and thought-through commentary on current events of this pandemic. A very brief background of me. I'm 32. I've been running my own family's business mechanical construction company for almost 3 years now. We are a small to mid-sized company with about 300 employees and dozens of active job sites around the greater Seattle area in Washington State. For all the physical work that we do in the field, there is obviously not the option to work remotely. However, I have roughly 100 corporate employees who we have currently in a state of working from home is the standard, but the office is open to restrictions for those that want to come in, mask wearing, distancing, etc. Currently, about 15 to 25% of the office is full on a given day. In your episode 675, you briefly talked about the balance of reopening businesses while maintaining public health safety. Separately, you also brought up that local governments should be weighing multiple metrics when making decisions, such as opening up schools, restaurants, or bars. I wanted to ask, if you were in my shoes, what would you be paying attention to in terms of public health metrics to make decisions about how much to reopen or encourage office presence? While we have the technology and are mostly able to work remotely relatively well, being that we do physical installations and project teams mix and match all the time, I certainly see a loss of teamwork and camaraderie that is important not only for the business's health, but I believe our employee mental health as well. Thanks again for all the informative, level-headed discussion. If I had my way, you guys would be the universally accepted voice of reason for our country. Keep it up, Kevin. Well, doesn't get better than that. Let's just stop and go home.
Thanks, Kevin.
Wait a minute, I am home already. So, any thoughts about what you should do about allowing people to come and go in the office space?
Test positivity rate in your area is a good standard.
Yes.
Okay. I don't know quite where to draw the cutoff. Different people have drawn it in different places. I think if you're down less than 5%, you're in pretty good shape.
Yes.
Right.
What do they do in Massachusetts? You guys are pretty
5%. Yeah. So Mass has what I regard as one of the best responses, although I will say we too have experienced a second wave. It was in fact bigger than the first wave. And it is ongoing, although the latest numbers are showing a slight tapering off since they partially shut some stuff down. They've got a curfew on restaurants now, and they've gone, back to some earlier lockdown type measures. So there's sort of half dialing things back, and case counts may be coming down as a result. But the cutoff since very early in the pandemic has been a 5%. Test positivity rate. And that's kind of a general indicator that you're testing enough. So you're actually 95% of the people you test come out negative. That means you're not just waiting until somebody shows up in the ER before you test them. So that's a good thing. And that also means that you're probably going to pick up a lot of cases that would not have been picked up otherwise. So that's one figure to look at. But I would also look at incidents per 100,000, and I forget what the cutoff is now for Massachusetts, but it's something where you can only go to Vermont and Hawaii, basically. So if your business is not one of those places, then you're above the cutoff for the cases per 100,000. And there are a couple of other measures that they use, but I would say, in the case of your business, as you say, the physical construction, you've got to have teams on site. I assume those teams are doing things like wearing masks and, to the extent possible, working with windows open and ventilation and keeping their distance. Although, obviously, if you've got two people picking up an air conditioning unit, they're going to have to be close. If you have the ability to test your employees, that'd be great. Although I understand there are medical privacy issues with that, and it may not be enforceable. But I would say, I don't know, for office workers, it's going to be real hard to justify encouraging people to come back to the office absent a vaccine. And And there might be legal ramifications if you do that as well, because if you tell your employees, okay, our cases are low enough in the community, we want people coming back to the office, and then people start getting COVID-19 from your office, and you could be on the hook for that. So my bias would be, don't reopen your office except to people who have to be there. I mean, if your IT staff has to come in to reboot something, then obviously they have to. But to the extent possible, people should continue working remotely, especially since we're now charging into a second wave.
Yeah, this is as bad as it's ever been.
This is as bad as it's ever been.
And it's not going to get any better real soon.
Yeah.
I mean, depending on your definition of soon.
Well, and in fact, right now, there's what's hanging over us all is Thanksgiving.
Mm-hmm.
And we don't know what's going to happen after that, because we don't know how many people did the inadvisable thing of going to some big gathering somewhere. And, we had just the 3 in our family. And I know people on this podcast have generally been responsible about this, but I don't know what other people have done. And my daughter's school, in fact, as a precautionary measure, they have already said that for the week following, for next week, it's going to be online school only for everybody. Even for the kids who were going to hybrid school, they're just online only for the week because they want to see what happens to case counts locally after Thanksgiving.
They must have listened to you.
My advice for what?
They must have listened to you.
They listened to, well, they didn't listen to me when I said they shouldn't have anybody in hybrid without testing on a regular basis randomly, but that's probably because that costs money, whereas this doesn't. So I would say for a business that's able to operate remotely, for office workers, continue doing that certainly through, into December till we see what happens with Thanksgiving. And the numbers you want to watch would be case positivity rate below 5%. Incidents per 100,000, you want to be at, whatever Massachusetts is setting, or what Connecticut, I think, has something similar. Look at the well-run states, and they all have figures for that.
I would
say.
So
I want to make. Sorry.
If you're concerned about the loss of teamwork and camaraderie, well, death will also have an impact on that.
Death will have a negative impact on your team.
Very.
I want to make another point about this letter, and that is that. This gentleman is running his family's mechanical construction business. Vincent said earlier to Peter that after Peter complimented us that we were preaching to the choir, and I think more and more we're picking up people who are not really necessarily in the choir. People who are looking for information. And I think that's really good. There's several of these letters that are like that.
I'm sure our audience leans blue, but I'm sure I am pretty sure there are folks listening to our podcast who may, in fact, we've gotten letters from folks who didn't like our political commentary and made it pretty clear the reason they didn't like it was because we're critical of the current administration. And they're listening, and we're talking about virology. And so there is a hunger for facts.
I think I would like to talk to everyone, okay?
Yes.
In a reasonable manner and tell you what the facts are.
And I'm fine with people having different value interpretations and different policy advocacy, and that's great. And that's, what makes democracy great. But we've all got to start with the facts. We've all got to start with the data. Let's
do one more. Did you have something to say, Rich? I'm sorry. You did say it already, right?
No, I basically said it. Right. I was going to, I will to shout out to my friend, okay, as further evidence that we are reaching people we don't ordinarily reach. I think I pointed this out to you last time, Vincent. I got this letter from a friend of mine from, 50 years ago, but that I haven't contacted for 20 years. Are you guys familiar with Adele's sausage in the supermarket?
No.
Well, have a look.
Send us some.
Yeah, have a look. This is a friend of mine who was a scientist and morphed into a chef / sausage maker. Okay, which is where he's made his life. And so have a look at the market. It's Adele Sausage is everywhere. I got a nice email from him. I haven't heard from him in 20 years. He says, "Dear Rich, I have a new friend who sent me a link to This Week in Virology. Today I began to listen, and to my delight, there was you." And he goes on. Can you imagine how weird that would be?
It's very weird, especially if you send him a link and he sends you back a real link.
Yes, some links.
I have bought Adele's in the past. I took once a picture of the package and I sent it to Rich. I said, "Hey, look what's here, your buddy." It's good stuff, actually. Cool. They have different flavors. Yes. Okay, one more by Alan, please. Can you read
I will read Marianne's email. Hi, TWiV team. Hello from cool Halifax, Nova Scotia, Canada, where the temp is about 8 degrees Celsius and winter is coming. And Vincent and I were in Halifax
That's right.
last year.
That's right.
Canadian Society for Virology. Nice town.
Very nice.
I've been using TWiV podcasts to help with the avalanche of data on SARS-CoV-2. It has made my daily walks with my dog more productive. Thank you so much for the work you all do. It makes a difference to us who are working so hard. Atlantic Canada is an interesting place right now, as evidenced by the New York Times article below. In Nova Scotia today, October 29th, we have 10 active cases of COVID-19 and no new cases. Anyone coming into our province from outside our Atlantic bubble, defined as the 4 Atlantic provinces with a population of about 2.4 million, must quarantine for 14 days and are followed by phone and or email to ensure compliance. There are steep fines in place for those who have been caught not being compliant. Most of our cases in the past number of months have been identified during that quarantine period, thus limiting the ability of the virus to spread widely in the community. Mask wearing is mandated for indoor gatherings, and people are very respectful of that on the whole. Kids are back in school, 9 years and older, wearing masks indoors, and most activities are either not running or are modified to accommodate smaller groups, wearing masks and being outdoors as much as possible. I think at some point there will be studies of how we've done it, and I think in the end what will stand out, besides lower population density, will be our reliance and value on community. We've been through a rough 2020 with Nova Scotia being the site of the worst mass shooting in Canadian history, a helicopter crash off Greece killing 4 members of our military family, and a Snowbird, Canadian military acrobatic flying team crash in British Columbia that killed another Nova Scotian, all during our lockdown period. Maybe this has helped people really appreciate how connected we are to each other. We often grumble about the changes we've had to institute in our lives, but we mask up and get on with it anyway. And in that way, we've developed a pretty livable new normal and maybe even delayed or avoided the worst case scenario for our economy. We're hoping to delay the second wave here as long as we can, and so far we're doing okay. To people saying it can't be done, we respectfully disagree. Diligence and listening to good science and public health officials work. We hope you guys will come visit Halifax again once we have access to a safe and effective vaccine. And gives the link to the Times article. And yeah, this is a South Korea-style success story, right? You've got a place that could isolate itself fairly well. They had a relatively small population that was cohesive, and when the leaders followed the science, they ended up with a response that was highly effective. And so, in settings like that, it could be done. It could have been done in larger, more diverse settings with a more reliable response, I suspect. Although I would also call out that Halifax has a brilliant history of response to amazing disasters, including one of the worst maritime disasters in history in 1916, I think it was. There was a ship loaded with explosives that blew up in the Halifax harbor, and before the start of the nuclear age, it was the largest man-made explosion in history. Destroyed the whole town, basically, and they rebuilt from that and responded to it in an extraordinary way. And it sounds like history is repeating itself with SARS-CoV-2. They're responding to this disaster in the way Halifaxians, if that's the term, have done in the past. So good job.
All right. It can be done, yes. As Alan said, you just need to have direction from above. And we didn't, as Peter Hotez made it quite clear. Time for some picks of the week. Dixon Despommier.
Yes, sir.
What do you have?
Well, I've identified an article in a travel website called Afar, and they're highlighting the fact that in Norway, they're building the first energy positive hotel. The hotel that's being built even generates energy on site for its construction. So there's no fossil fuels burned. And they've made this beautiful circular hotel, which sits, I think, on the mouth of a fjord. And it's an example of what can be done when you set your mind to it. And I just thought it was very uplifting to show something quite positive going on out there, at least. Even with what's happening now, people are still thinking positively on how to solve the climate change problem and the tourist problem too. This fits in very well with people that like ecotourism and that sort of thing. So I just thought we would enjoy seeing that.
It's very pretty.
Where are they getting their electrons?
From the sun, and that's what really puzzles me, because half of the year they don't get a lot of sun.
Dark.
Yeah.
But they get enough, and apparently I will have to read the article more fully to understand what's really going on, but it's all solar. Where they're getting it from is solar. And Norway is a huge producer of oil, by the way.
They're incredibly successful in the oil business. Yes.
Dixon, this did I share that with you? I can't really see. Did I share my?
Yeah, there
screen?
it is. Yep, that's sure. There it is.
There's your desktop.
So
there it is.
This thing in the back.
It's a glacier that's coming down. Right.
Yeah, okay.
That's a glacier. Yeah, that's right.
So it's very pretty. It looks like it's receding.
Gorgeous.
It looks like it's receding, doesn't it?
It
Yes.
does. Of course
sure
it
it
is.
is.
And the shape of that building reminds me of the Apple Cupertino headquarters. Mm-hmm. It's got and that's energy independent also. The whole roof is solar panels. So
Dixon, your office looks lovely in that wide angle.
Do you like it?
It's beautiful. I love all the pictures, the stuff. The desk is nice. The floor, you have good
Thank you.
lighting.
Thank you.
Very well done.
Thank you.
And today the sunlight is not blasting you out like it usually does.
No. The light from the little camera that you sent me is supplying all of this ambiance.
Cool.
So thank you again.
All right, Brianne, what do you have for us?
So in honor of the holidays and all of the cooking and eating we are doing around now, I have a cookbook called The Food Lab, Better Home Cooking Through Science.
Yep.
The author of this book is Kenji Lopez-Alt. His dad is an immunologist who has
Is that Fred Alt?
His dad is Fred Alt.
Really?
Yes. Who has done lots of work on VJ recombination and antibody production.
Of course.
And so Fred Alt's son is Kenji, a chef.
How cool.
Who has written a cookbook and talks about the science behind all sorts of different parts of cooking in this book.
Stuff.
And so it's a really, really outstanding cookbook. And it's pretty interesting because if you want to find out the science behind different types of cooking or different, the Maillard reaction or all of those kinds of things, it's all described in here really nicely.
I was a postdoc with Fred Alt in the Baltimore lab. We were overlapped, and then Fred came to Columbia for his first.
He was at Columbia when I was a grad student there.
He was a MacArthur fellow, right?
He occupied an entire floor.
Yeah, he did.
Massive lab.
He did very well.
His lab, he was one of my professors in grad school, and his lab.
Yeah, I assume that he moved to Boston rather because the striped bass fishing was better up there.
Well, you can imagine the fish cooking section of this book.
No question about
Quite
it.
impressive.
So every Friday,
and you've just inspired me to put another pick that I'll do in the future. That's on this same theme. It's cooking science.
So we used to have lab meetings, floor meetings on Fridays, and Fred would always go into David's office and ask him what kind of sandwich, and then he would go to the sub shop and bring it back for him every Friday. And then the two of them would sit there while everyone's sitting around and unwrap these huge subs, kind of like Condit before a TWiV, and just chow down. So I heard a podcast with Alt Lopez where he described, he's got a restaurant somewhere in California, and their specialty is sausages. And he describes how it was to open it. And he basically says, don't open a restaurant. It's really hard.
That's true.
He said, like, the night before they opened, the plumbing died. And they had to delay the opening, and it cost them $30,000 to fix the plumbing, stuff like that. He said, don't open a restaurant. If you love cooking, don't open a restaurant.
Restaurants are the most commonly opened small business in America, and they are the most commonly closed small business in America.
So one of my favorite movies is called Big Night. and it's about the closing of a restaurant. I highly recommend it. It is an absolute gem. You will love it.
Alan, what do you have for us?
What I have is a pick that is topical to this particular episode. It's a short article in Morbidity Mortality Weekly Report by a bunch of authors at CDC, et cetera. This is the ACIP ethical principles that they're going to try to follow to allocate initial supplies of COVID-19 vaccines in the U.S. And they've just published this document. This is an initial outline of here's what we think the important issues are in determining who's going to get the first doses, and then saying based on that, we expect that these groups and its healthcare providers, essential workers, the elderly, people with unique risks, would be the ones allocated first. The reason I'm picking this is not only because it's timely, but also because people can comment on it. This is going to be a matter of public policy. You can send comments to the Federal Register if you have thoughts on this issue, and I'm sure a lot of our listeners do. So they can go ahead and weigh in on how they consider these standards ought to be weighed.
That's cool. That's cool. Who's next? Rich, what do you have?
This is kind of like picking the sun or water or something like that.
Yeah, it is.
But I had to do it. It's the Mandalorian. Okay, if you haven't watched it, you need to do this. Especially if you're a Trekkie, you're already watching it. This is where Baby Yoda comes from. We watched the latest episode with my family this morning. It's entertaining.
Not a Trekkie, no. Star Wars.
Star Wars.
Well, same,
No, they hate each other. Don't they hate each other? Trekkies.
I don't hate myself.
The only objection to that is that every time there's an explosion in outer space, you get to hear it.
Yeah, and you see flames.
Right.
Yeah.
By the way, so the podcast I was referring to, Kenji Lopez, is called "Why You Shouldn't Open a Restaurant." It's Freakonomics podcast. It's really good. It's really good. My pick is here now. Those of you who are listening, I'm sorry. I have a book I'm holding up, T-Rex and the Crater of Doom by Walter Alvarez.
Great title.
Yeah.
Great picture too.
Title.
Yeah.
I read this a long time ago, actually, but I just glanced over at my bookshelf, and it's a discussion. He's a scientist, and he discusses, the evidence that a asteroid, I guess comet or asteroid,
or a meteor,
hit into the. Well, he says here, comet or asteroid. Well, that's not. You see in the back, but it hit the Yucatan and made a mess, and that's what was responsible for the extinction. It's got some artwork in the middle that's really funny. Let me show you this. Here's some of the. So you can see the comet, and then after the impact, and then the whole Earth atmosphere got screwed up for a while. Of course, those are artists' interpretation, but the impact made a tsunami, right? They got a picture here of this one dinosaur kind of surfing, but he's got a look on his face like, uh-oh. And then here on the left, these two guys are just hanging out, and there's this huge wave about to hit them right behind them. It's really funny. Well, it's funny. They died. It's not so funny, but well,
it's funny to us because we're the little rats that were running around that would, succeed.
Anyway, it's written really well. It's one of those things where he explains the data beautifully. Sorry, and I really enjoyed reading it. So you should check that out. All right, that'll do it for TWiV 687. Microbe.tv/TWiV is where you'll find the show notes. Send your questions and comments to TWiV@microbe.tv. And if you like what we do, go to microbe.tv/contribute. The Parasites Without Borders gig is over, end of November. And you can contribute there. We'd appreciate it. Dixon Despommier, Racaniello.org, thelivingriver.org or .com, one of those two. Thanks, Dixon.
Thank you. Good.
What's good?
Everything.
Good. I'm glad to hear it.
This was very good. Very good.
Did you cook turkey yesterday, Dixon?
No, we decided to postpone because we're having it with Marlene's children.
Sorry, you said
so we're going tomorrow to celebrate Thanksgiving.
Okay. Brianne Barker is at Drew University on Twitter, BioProf Barker. Thanks, Brianne.
Thanks. It was great to be here.
Rich Condit is an emeritus professor, University of Florida, Gainesville. Boy, talk about bubbles. That's a bubble. Currently residing in Austin, Texas. Boy, talk about bubbles. That's a bubble. Thanks, Rich.
Fair enough. Always a good time.
Listen, folks, don't get insulted. Don't get mad at me. Please, it's fine. All right. The only thing I want you to do is listen to science. And it's really inexcusable that you're not, just because you're in a state where your governor or senator says you don't need to wear a mask. It's crazy. It's really crazy. What do you think your surgeons wear masks for? Okay. So don't get mad at me.
Even the Lone Ranger wears a mask.
Alan Dove is at alandove.com. On Twitter, he is Alan Dove. Thanks, Alan.
Thank you. It's always a pleasure.
I'm Vincent Racaniello. You can find me at virology.blog. Watch this. I'd like to thank the American Society for Virology and the American Society for Microbiology for their support of TWiV, and Ronald Jenkins for the music. This episode of TWiV was recorded, edited, and posted by me, Vincent Racaniello. You've been listening to This Week in Virology. Thanks for joining us. We'll be back next week. Another TWiV is viral.